This is our lab prescription that we're going to fill out to send to the lab to get them to fabricate a crown. So for doctor, you can put in your partner's name or you can make up a doctor's name. My doctor is Dr. R. Smith. The date sent is today. Today is April 13th. My patient's name is Robert Jones. The time that we want this back. Sometimes we need to look at a calendar. Today is the 13th. Today's going to be a travel day. Many laboratories close on the weekends. Then the lab needs 3 days to work on the crown. Then they're going to send it back on the 19th. That's our other travel day. So we're going to mark inside on our lab prescription that we want this back on April 19th. Because April 19th is another travel day, we cannot book Robert Jones to come back to get his crown inserted until April 20th. So we're going to write a little note to our lab telling them to fabricate a porcelain fused to metal crown. We can use the acronym PFM so that they know what we're wanting. We now have to fill out the requirements that we need. Because it's a porcelain fused to metal crown, we need to know the type of metal. Gold, semi-precious, or non-precious. A lot of this you can make up as you go. This is something that you would ask your dentist. Our dentist tells us he wants semi-precious. The occlusion of the tooth, because we're working on an anterior tooth, the occlusion actually refers to the lingual side of the tooth. Does the dentist want the lingual side of the tooth to be metal or porcelain? Our dentist says porcelain. Centric relation. What centric relation refers to, I'm going to show you on the Dexter mouth. Many dentists will take a little piece of foil and they'll put it between the patient's teeth. And as the patient bites together, sometimes they'll use a piece of paper. When the patient bites together, will this pull out? This is called foil relief, that the patient does not bite so hard that this doesn't pull out. If they want to have a positive contact, when the patient bites together, they bite so hard that the paper doesn't come out. When we look at cusp fossa, this has to do with the posterior teeth, with all of the cusps. Do the cusps bite together? Our dentist is saying that he wants foil relief. Lateral excursion has to do with when our patient bites together and the jaw moves from side to side. We look at the cuspids, or the threes. Sometimes this is referred to as a canine rise. As a person bites, does the teeth come around the cuspids, or does everything work in a group function that the cuspid isn't a little bit longer? Our dentist tells us that he wants cuspid guidance. Margin adaptation has to do with how the margin of the tooth fits onto the preparation. We're again going to go into the Dexter mouth so that you can understand this. When a crown is placed into a patient's mouth, what the margin adaptation is does the margin of the crown completely meet the margin of the preparation? Or does the margin of the crown overextend just slightly? That's dentist preference. At Columbia College, we teach that we come right to the margin of the preparation. So we're going to write that we want it finished exactly to the finish line. The labial margin says fine metal collar, porcelain to margin, or porcelain butt margin. I'm going to explain what each of these mean as well. When we have a crown and we have the fine metal collar, sometimes when a dentist is making a crown, they'll have the labs stop the porcelain so that there is a fine metal collar around the margin of the tooth. Sometimes the dentist wants the porcelain to come exactly to the edge, so that's called porcelain to margin. The third way a dentist will have a crown fabricated is they'll have the metal stop a little bit early and have the porcelain extend beyond. So this portion would just be porcelain. This portion would not have any metal on the lingual side or on the inside of the crown. So our dentist wants a porcelain butt margin. That's when the metal doesn't go right to the edge, just the porcelain does. Pontic design, this would have to do with a bridge. We're not making a bridge right now. We're just making a single crown. So any of the Pontics doesn't have anything to do with what we're doing. The contacts has to do with when the tooth, again, is placed into the mouth. We're looking at the actual contacts between the teeth. Do we want a broad contact? Broad contact means that the contacts interproximally come right up to the embrasure, that we can see that there's contact with the adjacent tooth. A normal contact means that we have the normal embrasure and we just have a bit of contact between the two, the crown and the adjacent tooth. A point contact means that basically just at the point we just have contact in this area. So this again, this has to do with dentist preference. Could have to do with whether the patient has periodontal disease, their ability to keep things clean, how the other teeth look. So our dentist is going to say that he wants just normal contact. We then remember the shade that we had chosen when we did our first shade check at the beginning. The shade that we have is a 6C or a 440. So we're going to write this down, 6C or 440. Okay? This area here, if the patient had any kind of markings, lines of a different color on the tooth, a dentist will sometimes draw that in, send that to the lab saying that they want certain markings in a different shade. This, again, is dentist preference of what the dentist sees in the patient's mouth. When we're filling out our lab prescription, we want to make sure that we are not causing any type of cross-contamination with our patient. I've been showing you in Dexter's mouth while I've been filling this out, but for your purposes, don't cause any kind of cross-contamination and contaminate our lab prescription or our clipboard.